Welcome to the Oncology Nursing Podcast. Today's episode is part of our Health Policy and Advocacy series. Nurses are the most trusted profession in the United States and have an important voice in shaping health policy work at the local, state, and national level. These episodes give oncology nurses a chance to hear from the nation's top leaders and gain understanding of how federal legislation is implemented and affects public health. Thanks for listening to the Oncology Nursing Podcast. I'm your host, Lisa Kennedy Sheldon, and today we are joined by Tara Schwetz, the Acting Director of the National Institute of Nursing Research and Associate Deputy Director of the National Institutes of Health. Prior to assuming this role, Dr. Schwetz was Chief of the Strategic Planning and Evaluation Branch in the Office of the Director at the National Institute of Allergy and Infectious Diseases. During her tenure, she has led several efforts, including conducting an evaluation of the Centers of Excellence for Influenza Research and Surveillance to facilitate evidence-based decision-making and developing the NIAID strategic plan for tuberculosis research. She received a Bachelor of Science in Biochemistry with honors from Florida State University and a PhD in Biophysics from the University of South Florida, followed by a postdoctoral fellowship at Vanderbilt University. Dr. Schwetz has received numerous awards, including fellowships from the American Cancer Society, the American Heart Association, and the NIH. Thank you for joining us today.
Thank you for having me. I'm excited to be here.
You know, the National Institute of Nursing Research, NINR, has a special place in the hearts of oncology nurses in particular, as well as all nurses in the United States. The NINR is a national body for building the scientific foundation of clinical nursing practice and improving health. It promotes the role of the nurse in health and research to improve healthcare. So to start us off today, what are some of the NINR's key initiatives for 2020?
Yeah, so some of the activities that we're doing in 2020, which has been already an unprecedented year, I guess we should say. We're really excited to be able to promote here today. In honor of the Year of the Nurse and the Midwife, the WHO recognized earlier this year, NINR has launched, or will be launching actually, a feedback campaign to really better understand what nursing research means and also to better understand what the future may hold for nursing science. And we're doing this to really gather some information to learn more from our community and collectively begin describing what we hope will be the next frontiers of nursing research. And so I encourage folks to check out our website because we have more information about this initiative there. Some of the other things that we're doing later throughout the year include our Division of Intramural Research will be holding a virtual symposium to mark a milestone anniversary. So in 2020, we're celebrating 20 years of the Summer Genetics Institute. And the Summer Genetics Institute really was created to address how omics methodology has advanced symptom science research, define approaches to developing biobehavioral interventions that modify symptoms. And it really features an interdisciplinary and innovative research that has impacted nursing research and practice. And this year, while unfortunately we are not able to gather everyone together this summer, we are still holding our symposium on June 22nd. So I encourage people to participate in that virtually with us and mark this milestone. And we are also opening soon the registration for our 2020 NINR Methodologies Boot Camp. The date of this, which is now also going to be virtual, is August 3rd through the 6th. And this year, the topic is focused on artificial intelligence. And we have a really impressive lineup of speakers from across the nursing science community, but also the data science and AI community that are really going to speak to the vast array of different approaches that can be used in this space. Finally, and I think most probably of your listeners are aware, that we are in the process of hiring a permanent NINR director. This is a really high priority of NIH leadership. So hopefully we'll be able to announce that sometime later this year.
Well, there's certainly a lot going on, Tara, and it's great to have you there at the helm. And thanks for mentioning the Year of the Nurse. It was a big event, I think, for all nurses to hear the WHO acknowledge the importance of nursing and the anniversary of Florence Nightingale's birth. But even more importantly this year, in ways we didn't expect, nurses are certainly being celebrated for their contributions to health. And you know that I was going to talk about this in a little bit, but it's really hard not to bring up COVID-19 in the forefront of discussions right now because it's impacted so much of life and certainly impacted clinical care. How is the NINR supporting nurses and other public health professionals during the pandemic?
No, that's a great question. I feel like in many ways, we've all been living and breathing this in a variety of different ways. And it's really created this unprecedented global challenge, as you mentioned, in 2020, right, the year of the nurse and the midwife. I think that in many ways, the COVID-19 pandemic has really highlighted and accentuated the valuable role that nurses and nurse scientists play in research and obviously providing care to patients. And that has brought to the forefront with this current crisis that we're under. And, in terms of the work that is being done by nurse scientists, we're really proud of the efforts that they have. And I know some of them are being pulled in multiple directions because they have clinical care responsibilities on top of the research that they are conducting. And we really applaud their efforts and understand the demands on their schedules. But NINR research, which is done by many nurse scientists from across the country and around the world, as well as other scientists, have helped to provide and really strives to provide a foundation of evidence to guide best practice in clinical settings. And one of the areas is in advances in infection control. So in response to the COVID-19 pandemic, NINR is participating in 2 COVID-related NIH funding opportunities. We are participating in Notice of Special Interest, or NOSI, that highlights the urgent need for social, behavioral, economic, health, communication, and epidemiologic research that's relevant to SARS-CoV-2 and COVID-19. And we've also joined an initiative supporting research on biopsychosocial factors of social connectedness and isolation on health, well-being, illness, and recovery. So I encourage folks to check out the grants.nih.gov site, where you can find out more information about the funding opportunities that we have joined. But we're also, internally, our staff are really working hard and coordinating with other ICs across NIH to brainstorm and develop ideas to address the COVID-19 crisis. And on our NINR website, we've actually developed a new web feature drawing attention to how nursing research supports infection prevention and control efforts, and really highlighting NINR-supported research on healthcare-associated infections. And as we've indicated, there are a variety of different resources that are available. And this is obviously a emerging and rapidly evolving situation. And so I encourage folks to check out the latest research information from NIH on nih.gov/coronavirus. Grants.nih.gov website has also a lot of information, a wealth of information for applicants and grantees on what is going to happen with my application that I just submitted. Will this be processed normally? Do I have to draft anything in any kind of different way? What happens because my research has been put on pause because all of our labs at our institution are shut down? There's a ton of information on that website. They update the frequently asked questions on a regular basis, and I really encourage folks to review those and or reach out to their program director. And I'm sure they'll be happy to answer any questions.
Wow, you certainly have a lot going on, and a lot. I think that nurses, particularly oncology nurses, have thought about always. And infection prevention, while it wasn't that kind of groovy before, it's more important than ever now. And so I think we're seeing infectious disease specialists and infection control nurses all of a sudden becoming heroes in our websites, and we're all learning a lot about virology at the same time. So it's great that you've been able to highlight that work during this pandemic. Certainly more important than ever. I also wanted to talk a little bit about some of your other clinical resources, and one that resonates, I think, with oncology nurses are the end-of-life care and palliative care resources that you have in Conversations Matter. And this is certainly a special interest, I think, to all of us in oncology nursing who are often trying to meet the palliative care needs, the goals of care, and even caring for patients and families as they approach the end of life and as they grieve afterwards. Can you tell us a little bit more about this?
Sure. Yeah. Our palliative care Conversations Matter campaign was developed to increase the use of palliative care for children living with serious illness. And this campaign offers really much needed evidence-based resources, both for the providers, but also for families. And The materials that we have developed include a variety of different videos, tear-off pads, resource cards, fact sheets, provider toolkit, brochures. We really span the gamut of different materials that are available to healthcare providers and families with seriously ill children. And we brought together parents and palliative care clinicians, scientists, and other professionals to really offer their input and expertise on what they felt was needed and missing to fill a gap there. And the materials are designed to assist healthcare providers with starting and also continuing these really challenging conversations about pediatric palliative care with their patients, but also their patients' families, and really raise awareness and empower families to begin a dialogue with their healthcare providers. Of course, those materials are also available on our website.
Yeah, thank you for pointing that out. I wanted to make sure our members knew to look there as well for that information. Now, the NINR is one of 27 institutes and centers at the NIH. How does the NINR collaborate with other institutes? And can you share some of your joint initiatives?
Yeah, sure. As you said, we are definitely one of several NIH institutes and centers. I think NINR in particular is one of the few institutes that's quite unique. So many of the institutes and centers are very body part or disease focused. And at NINR, we remain pretty agnostic to those. Our portfolio spans the gamut from a variety of different diseases or conditions and population-based research. And this enables us to have broad collaborations with various different institutes and centers on a variety of different topics. For example, symptom science is obviously a really important part of our portfolio, and we participate as a member of the NIH Pain Consortium, which is an internal NIH committee that is really focused on advancing pain research. And we also participate in the HEAL initiative, which is another large initiative across NIH that is focused on pain itself, as well as preventing opioid use, abuse, misuse. And there are a variety of other different partnerships that we're involved in, and including many of the COVID-19 efforts that I've mentioned. Those are done in partnership with a variety of different institute centers across NIH. So we're constantly trying to leverage our partnerships that we have with the other institute and centers to enhance and facilitate nursing science across NIH.
Yeah, that's amazing when you think about the resources and the expertise you have available across the NIH and that ability to collaborate. When I was at the NINR, I was intrigued by the fact that you have a lot of laboratory equipment. And I'm going to guess a lot of our members don't know about that this is, even in your symptom science work, requires a lot of technical aspects, laboratory bench science. Can you tell us a little bit more about your labs?
Yeah, sure. At NINR, we have a nice intramural program that really leverages the symptom science model. So we developed a few years ago a symptom science center that is really beginning to fully characterize in a really deep, meaningful way symptom phenotypes, as well as genetic and other omic approaches to identify biomarkers and pathways that affect outcomes, but also to take into account environmental factors like diet, what we eat, our different behaviors, our lifestyle, and help pull these data together to develop clinical intervention. So within our intramural program, we really span the gamut between areas that are looking at cancer-related fatigue to traumatic brain injuries. So our researchers within our intramural program use the NINR symptom science model to really address these complex research questions and improve clinical care. But yeah, as you said, we definitely have a lot of really amazing science that is being conducted in our intramural program. In addition to cancer-related fatigue and TBI, we have scientists that are investigating the underlying processes of the primary senses so we can understand fundamental molecular, behavioral, neural mechanisms associated with chemosensory symptoms, so taste and smell, in metabolic conditions like obesity and type 2 diabetes, and developing a framework for obesity risk based on genetic risk scores and gene expression profiles. Our newest addition to our intramural program is an advanced visualization branch. And they are looking at utilizing technology in a really unique way to develop and evaluate augmented and virtual reality experiences and engage participants in these sort of multi-sensory experiences to examine the impact on health behavior. These simulations will hopefully enable patients with self-management goals to rehearse problem-solving behaviors kind of in real time in either virtual or augmented reality to help improve their health outcomes within a variety of different environments, including home-based care.
Wow, that's really interesting to think about, being able to use that augmented reality, especially for behavioral health, where you come into those circumstances where the trigger happens and you may, whatever that is, smoking, overeating, deciding not to go for a walk, whatever we know optimize health. So that's fascinating that you're training nurse scientists to do that.
Yeah, absolutely. And right now, some of those things that you mentioned right now, I sort of feel like are on display in real time, right? As we're all sort of sequestered at home thinking, do I have to get up and go for a walk? Should I be active today? Should I just eat one more cookie? These are, of course, not as nearly as severe health-related concerns, but they're perfect examples of those sort of behavioral.
Oh, absolutely. And as we think about more sort of distance telehealth sort of app-based approaches to improving health, particularly behavioral health, this could have a lot of impact going forward in a world where we're going to be dealing with COVID for quite a while.
Absolutely. And I think that is an area where research is definitely going to be needed and warranted because of, as I said, with the current pandemic, you can't treat patients in the same way that you could prior to it, at least during this acute period. It's still unknown what the post-COVID-19 world will look like and how that will really shape patient care and caregiving.
It may reshape funding opportunities as well. We're already seeing some of those add-ons that came out of the NIH very quickly, actually. That was remarkable that we've had the ability to say, yeah, that was your study, but how now is it affected by COVID, may have implications for future research opportunities as well. Now, you're right out there at NINR, right outside Washington. How does NINR work with other policy groups?
Sure. Well, one great example is doing podcasts such as this with ONS to really interact with our constituents more broadly, but also to promote what we at NINR do. But, NINR is a component of a federal agency, the NIH more broadly, and we have certain restrictions around what we can and cannot do, particularly as it relates to legislation and sort of lobbying for support on the Hill. We have very, very well-defined limits on that, and we take that really seriously. But we are obviously always happy to answer questions that the societies or other organizations have about the science that we support, training opportunities that we offer, and of course, the exciting research and the research findings from our investigators. We really are always excited to promote that. And I know I mentioned a few of our upcoming events already on this podcast, and we're always trying to promote those as well to really share information about what we're doing, what our community is doing, and of course, what is going on at NIH more broadly. And, we interact with a lot of different groups. One thing that we do every year is hold a roundtable each year. And I know ONS has participated with us in that in previous years, and we're really excited to continue to do that going forward.
Yeah, we'll make sure we share those with our nurse researchers as well, because, in the past, they'd have to take off time from work to go to the methodology boot camp or the Genomics Institute. So here's an opportunity to, have that education, that level of training from the NINR right in your own home.
That's right. And I think we're seeing that in real time. We held our first virtual NINR director's lecture a few weeks ago, and we were a little nervous. We didn't know how it would go. We'd never done one completely virtually before. And we were astounded by the attendance online. We had over 850 people tune in, which, we were saying we always generally get a really good turnout, when we hold these in person, because we also videocast them when we do that as well. But I feel like this broke our record. So I think it's, as you said, people are at home and just really leveraging the opportunities that are available.
Yeah, it is remarkable. So thank you for doing that. And I wanted to say you are a great partner. And so ONS has had the opportunity not just to visit with you at NINR, but also now to plan our symptom science research consortium next February with NINR and the NCI. And ONS, which is a very unique program. I think when we were thinking about planning it, we were thinking in person, sharing research and evidence, thinking about mentorship for the next generation of scientists. And who knows, it may be virtual now, but now that we know we have those abilities to pull each other together and to be together, whether it's virtually or the richness of an in-person conference, we're bringing and elevating nursing science. And so ONS certainly appreciates your partnership.
Yeah, absolutely. No, we feel the same as well. I think it's a great opportunity for the field.
One other thing I wanted to talk today about is, we get very much, as you said, kind of have institutes that are very organ specific. Certainly in the world of cancer care, where, people are somebody with breast cancer or prostate cancer. One thing I've really been wanting to advocate for a long time is more cancer prevention. I would love not to have any more cancer cases. And, thinking about, with those behavioral, AI we've been talking about and other funding opportunities, how can nurses be more involved in cancer prevention?
That's absolutely a great question. Obviously, oncology nurses play such a pivotal role in this space. And it's really important they have the best, most accurate, solidly evidence-based information to treat their patients. And NINR supports science to do just that. And the science we support really focuses on developing new interventions and strategies to assist families, healthcare providers, to encourage cancer screening, manage symptoms of serious advanced illness, support the caregivers themselves, and also, as did before, planning for difficult conversations, including end-of-life decisions. So, NINR has supported research that has addressed concerns of specific populations regarding cancer screening. We have grants that promote health literacy, which can be barrier to cancer screening, especially in underserved populations, and really help promote those within certain populations. We also offer a variety of different resources on different aspects of preventing and living with cancer, both at NCI in particular, who has excellent online resources, but also NINR as well.
All great points. Because we do take care of people across the spectrum of, prevention and screening, diagnosis, treatment, and into survivorship, and sometimes into end of life. And we also have the time. We spend so much time with families. We have often the teachable moment, not just with the patient, but with the family members, whether that's tobacco cessation when a family member develops lung cancer, or hereditary cancer discussions when someone develops cancer. So we have to be literate about the full spectrum of care, and that has to include prevention. So we're delighted that you're involved in that as well. So we're almost at the end of our time. What do you have for last comments that you'd like to share with oncology nurses about the NINR and your research and funding opportunities?
Sure. I would just say to keep up the good work. I think, as I indicated before, oncology nurses play such a key role in providing care, particularly to our cancer patients. And as NINR often partners with NCI on some of these initiatives, we definitely appreciate, again, the unique space that ONS and its community and constituents make up. But I definitely encourage people, particularly because of this and the uncertainty in the current time, when thinking about the research that they might want to conduct in their own labs and promote, to really check out the variety of different resources that we have available. Because you do understand that these are challenging times for us all, both personally, but also professionally, for people who have had to scale back their research and are uncertain about, how long it will take to get things back up and going, and to be able to have the resources available to conduct the research that we know is pivotal to ensuring the health of our nation. Because while COVID's important, absolutely, we also have a lot of different health considerations that we need to be studying as well.
Oh, that's great. Thank you, Tara. And thank you for sharing your resources and your personal availability of staff at the NINR to help people who are either doing research or interested in more training as they go forward. And certainly the virtual opportunities during this time, probably more important than ever. So thank you so much for joining us today for the Oncology Nursing Podcast, and be well.
Thank you, too, and thanks for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.